Welcome to your training. I'm so excited that you're here. I love when I get to share the systems, the information that I've gathered over my 24 years. In case you don't know who I am, let me introduce myself. I'm Debbie Seidel-Bickey. I am the founder and CEO of Dental Practice Solutions. I started out many decades ago working in the dental office as an assistant and office manager. I helped many young dentists start their practice, an orthodontic office, a pediatric dentist. And I also went to University of Southern California and became a dental hygienist. Fast forward, I have worked in academia as a clinical assistant professor at the University in Southern California, as well as I am a former hygiene department program director. And what I've been doing for the last 20 years is helping dentists around the world to optimize their dental hygiene department without working harder. Now, backstory on why we have this training today, this webinar, Power Hour is what I'm calling it, because I'm planning on delivering powerful tools to you to take back to your office. Backstory, in '08, we had a pandemic. Do you remember? It was an economic decline, and dentists called me frantic because they told me this word, hemorrhage. Debbie, look at the hemorrhage in my schedule. And these dentists, they were dismissing their hygienist. They decided not to have a hygienist. They were going to do the hygiene because they felt like they didn't even have enough patients coming in to have a hygiene department. And so I learned how to help dentists overcome these obstacles. And because dentists in particular run by fear, they literally told me they were frozen and couldn't decide what to do. They couldn't make a decision. And the best thing that you can do is make a decision quickly. And the best thing you can do right now, coming into November of 2024 in the USA, and there's a lot of chatter and a lot of stress going on in our world, is to stay ahead of the curve. And I have presented you with a handout. You should have received several emails. The most important page is this last page with your next steps, with a commitment, at least a commitment to do one thing. I'm going to share a lot of information with you, and I want you to choose one thing that you will implement tomorrow when you go back to your office, whenever that next day is in your office. And then I've also given you an opportunity to join our small group. It's a small group of dentists and hygienists, and I am going to do a specific customized training for each of the small groups. Their dental office gets specific coaching. And you've been chosen because you're here today to be part of the small group. If you will book a short call with me, there are many ways that I can come alongside of you and support you. My team is gearing up for our best year since 2017, since before the pandemic. We're about to have our best year ever, and I want to share with you everything I have so that you can have your best year and stop working so hard. I want to come alongside you and ease your pain, reduce the stress in your life. There's an easier way to do dentistry. So let's get started now. The worst thing that's happening is doctors are feeling stress. They cannot make a decision. You went to dental school to be a clinician, and now you're faced with a lot of business decisions. So that's why I'm here today. The best thing you can do, I'll repeat it again, and then at the end, there is a way that you can have some guidance, and the ROI is like you've never seen before when you get my help. You can go to our website, dentalpracticesolutions.com, and you can speak to the doctors. You can actually see and read the outcomes that they've had. It's higher than investing in the S&P 500. It's higher than buying real estate. when you allow us to come alongside of you and help you. I want to ease your pain. I want to reduce your stress levels. What are these cancellations costing you? Have you even looked? You probably aren't looking because you don't want more stress. Let's stay connected. If you decide not to open up my emails, at least follow me over here on Facebook, on Instagram, LinkedIn. I've got a lot of you following me on LinkedIn. Some of you are over there on Instagram. So we're going to talk about what are these holes costing you, how to set up expectations for your patients so that they value what care you can provide them and that they want what they need, that they're asking you, how do I pay and schedule for this? That's the best outcome. And I'm going to share with you a little snippet of how that can happen. Now, there's one thing that I created during the first pandemic in 2008, and it helps to reduce cancellations. It will grow new patient numbers, boost cosmetic cases. I'm not going to focus a lot on that because if you're interested, I hope that you'll spend 15 minutes learning more about it. I'm going to give you a lot of information. And if you want a deeper dive, you've got my information to connect with me to take a deeper dive, whether it be a workshop or 1 or 2 days in your office or 1 or 2 hours in your office. Do something, choose something to try and do it on your own. But accountability, when you have an expert come alongside you for accountability, checking in with you, when they help you to create goals, you're most likely to achieve those goals. Think about it. If you want to go on a diet and lose 10 pounds, then how are you going to get those 10 pounds off your body? Can you do it on your own? And when you've got a team that you're depending on to implement things, how easy is that? And that's why people come to me and they ask for my help. Let's look at what these are costing you. Here is the production. Now, this production in this office, they are not a client. It's just an arbitrary example. And I'm going to show you our clients are having $10,000 days. Our hygienists, I'm so proud of them. They're doing at least a minimum of $275 an hour. And our doctors are always doing $800 an hour. Look at these numbers. Hygiene, this is pre-appoint. We want to see this in the high 90s. And that's another course, another day. How do you get patients to schedule at their end of their hygiene appointment? But this is part of that attrition and why we have holes in the schedule. So you can see we've got a lot of patients, 276 patients out of about 1,100 in this office are not scheduled. So huge opportunities. Do you know how many active patients you are, doctor? And do you know how many patients in the last 30 days need a next appointment? We talked last month about reactivating. Now look at this schedule here. We've got a lot of holes in the schedule. And does your schedule look like this? Maybe it doesn't, and I hope it doesn't. But we were seeing this happen back in 2008, especially after the pandemic in 2020. A lot of offices came and we got them on track. They're doing, $100,000, $500,000 more annually without working harder because they have many of our systems that we teach in place. So like I said, we teach $800 production for the doctor's operatory. And that's $6,400 a day. It really isn't difficult if you have a strategy. And that's another system that we put in place for our clients is a schedule to goal strategy. The hygienists, I'm so proud of them. I look at their metrics and I can see they're doing 275. We tried to get them to 250 and they exceeded it by doing 275 an hour, $2,200 a day. And it's not difficult to do when you create the plan with your goals. And for many of the offices, congratulations to Georgia hygienists who can now provide the soft tissue diode laser. They can provide laser treatment for their patients. And I believe in laser. I've seen phenomenal results with the laser. And there's a way that we teach you to have your patients want the laser, especially patients with inflammatory diseases like rheumatoid arthritis, heart attack, stroke, high blood pressure, on and on. Hygiene annual production. Look, doctor, are you on tap? If you have one hygienist, it should be $440,000 this year in hygiene production, at least. That's what we're looking at. So if you have one hole, 275, 2 days during that week, you're losing $550 every week. If it's 2 days with the hole in the schedule each week, you're going to lose $27,500. Well, maybe you think it's not a big deal. I mean, you can give me the $27,000 if you don't think it's that much money. Our doctors, how many holes do you have in your schedule, doctor? And do you even know that there was a cancellation? Do you know if the ladies or the man at the front desk is scrambling to fill those holes? And our average client, the doctors produce $800 an hour in their operatory. Is that happening in your practice? And if it is, you want to be able to close, you want to plug the holes with some of these suggestions, these tips. Take one away and start implementing it. The best thing you can do is look at where you are today and then measure along the way to see how well it's working and tweak 10, 15 degrees along the way. The systems that we teach work. If you work the systems that you're taught by an expert, usually they work. And that's how our clients get to 100, 300, 500 more $1,000. Specifically since 2021, they're doing 300 and 500,000 more. They've got more hygienists that they have scheduled patients with, which is helping them grow. Your hygiene department, by the way, should be producing at least 30% of your total production. Look at that number as well. These numbers tell a picture. So, doctor, if you're not looking at your numbers, you do not know how to get to your end result. You don't even know where you're starting out today if you can't recite these numbers. Hygiene production. What is the percent of patients receiving a 4,000 code? Is your hygiene production producing at least 30%? Key number. And what is that per hour production for each of your clinicians? So, the doctor's losing 80,000. The hygiene department is losing 27,500 if you have just 2 cancellations in each schedule each week. Maybe you don't think this is a lot of money. I've actually talked to doctors. They don't care that they're losing this money. And I'm going to talk about the status quo at the end, because a lot of people are held captive. They're held prisoners by their team. They're letting the team drive the practice. And the doctor expected to be a dentist having this great life, and they're held prisoner because the team doesn't want to move in the same direction. So, doctor, what is your philosophy? Not only your philosophy of care, but business. Where did you imagine you would be today? And how can you get there? How can you achieve the goals and actually exceed them? Like I talked about those hygienists who I'm so proud of for now breaking the 250. They're at 275 an hour. The reason why we have holes in the schedule is because so many doctors are afraid to hold a stake in the sand or even in the concrete. It should be a stake in the concrete that patients need to follow a procedure should they need to change an appointment. Now, when I say that, I also want you to know that emergencies happen. People get sick. And so there are going to be some cancellations. We just hope it's definitely not more than 2 on each clinician's schedule each week. And so what if you think your team's filling it? How much time is it taking them to fill the schedule? So today we're here because I want to teach you how you can stop patients from even calling to change an appointment in the future. One of the secrets, if you listen no longer to this, it's urgency. How do you create urgency? And that's what we're going to talk about today, is how to create urgency. I've been a dental hygienist in an office in Newport Beach, California for 10 years, and my patients would freak out if they had to cancel their appointment. Why? I'll share that with you. Your first step is to set expectations. You must have a change of appointment procedure. That means that you update your patient's medical history, that new patients have a medical history, a HIPAA, even a smile evaluation, which we'll talk about later. What does that have to do with keeping appointments? Well, I'll share that later, but you're going to have a change of appointment procedure. People do not like policies. Call it a procedure. This is what, it's a procedure. It's the steps if they need to change an appointment. All new patients get this, and then annually they get it. When they update their health history, they're signing it. They're reading that they need to if they're going to cancel an appointment. And I say, nix that word cancel, because cancel means to like if you cancel a contract, it's not going to happen. And we don't want them to never come back. So I call it a change of appointment procedure. So you can also, on your treatment plans with your practice management software, you can customize your treatment plan. Your patients are signing their treatment plan, right? It's a legal document. It's setting up expectation that they need to pay. And at the bottom, it will say, we expect, and I'm telling you, most of our doctors want the patients to call 72 hours before they need to change their appointment. It's before their appointment is scheduled. So, like, what are you doing? This is a Friday or a Tuesday that you're watching this. And what are you doing next Tuesday? What are you doing next Friday? You probably know, right? And you've got it in your calendar on your iPhone, right? I have little pop-ups that remind me 1 week from today, tomorrow in 24 hours, I've got this going on. Do you do the same thing? And you want your patients to do the same thing. And I'm going to talk about that too when you're scheduling the appointment. Ask these people who are chronic abusers of your change of appointment procedure. They're always calling last minute to change their appointment. Ask them, Mary, can you do me a favor? Can you please mark your calendar? And do you have a pop-up in your calendar? Let me show you, Mary. Here's my calendar. Here's how I do it. This is how I never forget an appointment. Include in your reminders, in your emails, that we have a change procedure and we require 72 hours notice. I recommend the 72 hours. One of my doctors said, I want 72 hours. And I've stuck with that. I really like that theory. It's 72 hours. If you're closed on Friday, that means they cannot cancel legally. They can't change their appointment on a phone call, on your voicemail. They can't call Monday morning saying that they discovered or forgot they had something going on Monday at 4 o'clock. So there's a lot of things that you can do, but you've got to set up the expectation with your patients. What's included in your procedures? So here's what we share with our clients. It's we're telling them the long-term health of your total health is very important to us, and we know it is to you as well. Consider your overall health and the need for preventive care. We stress that you keep your scheduled appointments to eliminate disease and any unnecessary pain. We understand that illness, emergencies, flat tires, bad weather occur, and sometimes life happens. Our team will always do our best to serve your needs. However, we request that any appointment changes are made, and this is what we give our clients, and they can customize this, 72 hours. And then it says changing or rescheduling an appointment within 72 hours or more, within 72 hours or more is no charge. And we ask that you only call to change your appointment during the business hours. You have to call during business hours. Failure to give 72 hours notice during our normal business hours will incur a $100 charge or 10% of your treatment fee. True. Yeah. And you guys, I'm telling you, remember I showed you the picture of the prisoner. It's right now we've got doctors going, no way. Doctor, I told you, you should be producing $800 an hour. So if they decide that they got to get their nails or their hair done instead of come for their crown prep, or God forbid, that 2-hour implant, I mean, you're out a lot of money. And you think that they're your friend. I mean, I have doctors that tell me, oh, but Debbie, they're my friends. And if I have a friend and we're supposed to have lunch, I do have a friend, and every month we have a girls' night out. And I almost had to cancel a couple months ago, and you should have seen the look on her face. And imagine, yes, okay, I make a mistake. I did make a mistake, by the way. I double booked myself at the time we were supposed to leave for girls' night out. But you know what? I rescheduled that other time because I wanted girls' night out. And how can you get your patients to value and put their dental appointment in your office as a priority? What can you do? We're going to talk about that. So then we outline what is a broken appointment. Your patients need to read this. Change or rescheduled appointment with less than 72 hours notice. Arrived after. How much time can they arrive into that appointment? I mean, most places, if you go to get your nails done, your hair done, oh gosh, your eyebrows waxed. I mean, you're 15 minutes late, they're going to reschedule you. And then, by the way, they have your credit card on a file and they charge you $25. Oh, and by the way, many of our clients in other large cities are telling me, and I know it happened here where I live in Phoenix, that when you are making a reservation for a nice restaurant, you have to pay $25 reservation fee, and then that goes towards what you're going to spend at that restaurant or nice place that you'll be at. So imagine that you guys have a reservation fee, and we'll talk more about that. So anyways, we've got this. This is what we give our clients. I want to make sure that you have something like this, and every patient reads this. So do not allow patients to leave a voice message in your hours when you're out of the office, because it becomes a scapegoat. Do not allow them to leave a message saying they can't come in. They knew Monday through Thursday, if you're closed on Friday, they know your hours. Yeah, okay, maybe they're a new patient and they didn't know any better. I've been hearing that new patients aren't even showing up. Maybe you don't want it to be a new patient, but your patients of record, like every patient that comes in the next day that you're working in your office, bring out these change of appointment procedure forms, bring it out, get it put together, and have them sign it. Especially choose the patients who are updating their health history to sign this and read. So what does your voicemail state? I'm going to share that with you. This is a part of your procedure for patients to change their appointment. If they need to call your office, your voice recording will say, this is Dr. Bitkey's office, ABC. Thank you for calling us. Your total health is important to us. However, our office is closed, or maybe you're in a team meeting. We're in a team meeting right now. If this is an emergency, please leave us a message or call doctor's mobile number. If you need to change an appointment, we do not accept change of appointment messages by voicemail. Please call us during business hours or call doctor's mobile number at, oh, you guys just cringed. I saw it. Yes. Yes. You think that there are all these patients going to be calling doctor's mobile number, cell phone going, I can't come in because I gotta get my hair done. I can't come in because I forgot I have to take Johnny to soccer. Well, if you do have a patient that's calling because they're sick, they could leave a message. Let them leave a message. But when doctor hears the message, they'll let the team know that they called. Doctor, if you pick up that phone and that patient's telling you some ridiculous excuse, you need to refer to your change of appointment procedure. And you need to be bold, doctor. At some point, if you keep canceling girls' night out, if you keep no showing for that dinner date with your friends, are they going to keep inviting you back? They're not going to consider you a very good friend, right? Because every time you guys have something scheduled, you decide to call last minute. Oh, something came up. How does that make you feel? I know my friend, her face. Oh my gosh, I saw the cringe. Because she loves girls' night. Now, people don't love coming to the dental office, not too many people. Maybe I do because I'm crazy about dentistry, but I'm going to share with you step 3 and how you get patients to look forward to coming to your office. But you've got to be bold. You have to set the expectations. Step 2, what does your patient value? Do you know what your patients want? I mean, it sounds stupid to say, oh, Debbie, so glad to see you today. What would you like today? No, but there are some questions and I'm going to walk you through that. Here's what patients value: their money. They don't want to spend their money in the dental office. They don't want to spend it on unnecessary dental care, right? Their time. They don't want to take time off from work. They don't want to take time from taking Johnny to soccer practice. They don't want pain. Some patients want health. And some patients want a beautiful smile. These are your favorite patients, I hope. And what else? When you look here, what else? Can you think of something else that your patients value? Write that down. Share this information with your team, because these values are what you need to know so that before your patient has an objection, you've already overcome that objection. If you know that they want to keep money, they don't have a lot of money, you're already talking about how you can save them money. If time is their issue, the reason why they're not going to come in, the reason why they're going to cancel, the reason why they're not going to accept your treatment plan is because of time, you're going to already be talking about saving them time off work. Things like this. This is a sentence. I didn't put this in the handout, but tell your patients, prevention costs a little bit of money. Treating disease costs a lot of money. And when we have to treat disease, it takes more time. So we want to bring you back for prevention, or we want to get the hole in your tooth filled so that we can move into prevention, which takes a little bit of time, costs a little bit of money. Words that you're saying have power. And this is where you really need to sit with your team and understand if everybody's able to use these words and they just flow off their tongue like butter. Powerful words. Stop saying cleaning. Stop saying deep cleaning. People are pissed off when they have to pay thousands of dollars or they see a bill for insurance. Maybe their insurance is covering the majority of it. They're not too happy that it costs $2,000 or $3,000 for treating gum disease. Yeah, it can cost that much money. They're not happy. So use words like gum inflammation, gum infection, preventive care, not a cleaning. They're not coming back for a cleaning. They're coming back for at least a hygiene appointment. They're coming back for routine preventive care. So here's a list of words. You can actually write them down. You can stop this now. You can actually take a picture of it, but use these words. Like, I've been coaching offices for the last 4 years. And I've been in offices observing, and the hygienist is saying B, B, B. And I go, oh my gosh, later on I said, what was the B? And she says, oh, it was bleeding. And I said, well, what was the purpose of saying the B and not bleeding? She said, I don't want to scare the patient. But what do you think, if there's a way that you can set up the patients so they understand what's being treated, what you're evaluating, they know that you're evaluating their gum health and they hear bleeding. Do you think that's scaring them? And what if it does scare them? I mean, if their nose bleeds every morning when they wake up, or their finger bleeds every time they wash their hands, do they get scared? They get concerned, right? So when they hear bleeding, and if you guys have the AI for calling out these numbers during the gum evaluation, your CPE, comprehensive perio exam, let them know that they're going to hear these numbers. They're going to hear these words, and tell them 4 means inflammation, 5 is like infection in your gums, and we're going to create a plan together so that your gums and your body are healthy. That bleeding gums mean there's infection and inflammation. And talk to them. If another part of their body consistently bleeds, is that healthy? And why do our patients think that bleeding gums are okay? We now know, and if you guys don't know this information, you need to learn the information that bleeding gums year after year, it's a checkpoint for causing systemic inflammation, diabetes, heart attack, stroke, Parkinson's, and a lot of research, guys, a lot of research on Alzheimer's. Bleeding gums is a sign that your patient can have Alzheimer's disease in the future, not tomorrow. No, I don't try to scare the patients. I tell them it's not going to happen tomorrow, but year after year, if we don't put a stop to this, you will eventually have other systemic diseases. That's how it happens. And they can go to Google, they can go to the internet, they can ask Siri. There's a wealth of evidence-based research to back and support exactly what you're telling your patients. How many of your patients, if you ask them, I used to ask my patients before I even had all this scientific information, I would ask them, how much longer do you want to live? And they would laugh. I don't know. I said, well, do you want to live another 10 years? And they're like, well, yeah, of course I do. I said, then this is what we need to do, because what's happening now can cause life-altering diseases. Then they sit up and listen. When you explain it, like I can do some training with you at another time, but when you explain it in a specific way, using words they understand, they are most likely to sit up, listen, and take action. They will appreciate you. So as we look at this, I want you to write down some words that you will say to your patient. You should be taking some intraoral photos. Oh, and I love teaching our clients, the hygienist can do a scan annually, or they can scan at least on new patients during that appointment. Oh, I just love using the scanner. It's so much fun. It just, learning new things, it really can be fun. So what are some of the words? Show them the plaque, show them the discoloration of their teeth. I mean, a lot of the discoloration is because of the plaque. Ask them, do you like the way your teeth look? Are you happy with this? What do you see, Mr. Patient? Do you see the white spots here? This is because the plaque has remained and is basically eating through the enamel of your tooth. It's the start of the cavity. And do you see how the gums aren't flat against the tooth? They're rounded. They're inflamed. There's this gum right here on your lower right. Do you see the inflammation? I'll actually push. Maybe I have my gloves on, I push with my finger and I say, you see that inflammation? That's not normal. What do you think about this? They're like, it's always been that way. And that's not healthy. This is what leads to, and then I explain to them, what do you say to a patient like this? What are some of the words that you're saying? Stop, take some time to write down, what do you see? Ask your patients, Mr. Patient, what do you see? Do you like this? Are you happy with your smile? Tell me what you have for your goal. What is your goal for your smile? I can't imagine that this patient doesn't feel ashamed, that they don't feel embarrassed about this smile, but ask them, let them think about it. So of course, you're going to take some pictures and then sit them up and show them. Show them the heavy buildup of calculus. Show them the plaque. Show them the staining. Show them the holes and ask them, what do you see? When you ask your patients to participate, you are helping them to own their disease, and people who own their disease are a lot more likely to want what they need. Here's another one. What do you see here? Of course, we see bleeding gums. We see soft. It's very soft. It's not firm. The gums aren't firm. If the skin is soft and saggy, don't we think that's probably a sign of loss of skeletal muscle, right? Loss of skeletal muscle, if you're reading the research today, we know that is associated with other diseases. And same thing with our gums that are soft and spongy. It leads to other diseases, not just of the mouth, but the body. Bleeding gums is a sign of inflammation, and inflammation in our mouth leads to inflammation in the body. And you're telling him those other diseases of inflammation that can possibly start in the mouth. So, what else? It's your turn now. What can you write down from these pictures that we've seen? And work with your team so they guys are all saying and doing the same thing every day, all day long. I think that helping your patients, helping your patients own their disease is going to help reduce cancellations. What I've created many years ago is something called reason to return, or R2R. And this is how we communicate, all of us, the same value points, the same words, and we're understanding what our patients value. When is the best time to learn what patients value? Well, it's kind of awkward asking somebody, if I'm sitting here with this patient saying, what do you value? No, but it's during the new patient exam. And that's one of the things that we teach is during the new patient exam, there are specific things we want to know about the patient. And the words, how they respond, are the words that show value. Like, why did you leave your last office? What brings you here? Well, my last dentist took a lot of money from me. Oh, I was reading some reviews. True story. I was reading some reviews of dental offices, and it said that the doctor, and I'm going to talk about reservation fee, but they were taking a reservation fee, but they didn't finish the patient's treatment. And the patients had said, my doctor never finished the treatment and I'm having a hard time getting my money back. So I'm not going back there. You hear these stories and you kind of go, oh, money made them angry. So they're coming here. Oh, well, we moved. Oh, great. They just moved. Oh, well, it's too far from my work. Oh, time. My insurance told me. That's a really common one. But there are certain questions that you're just asking as conversational pieces. What did you like about your last dentist? Well, I liked how she took time with me. I felt like she really listened. Oh, wow, this is great. Like, these are things we all want to know. If I'm the hygienist that's getting this information, I'm writing it down and I'm letting my team members know, like, wow, she really liked the way her last dentist, and I'll tell the doctor too. I'll say, oh my gosh, she's just loved her last dentist. She felt like she really listened well. And, I was trying to, let her know this is, blah, 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 it's rapport. It can be rapport, even if you've never asked these questions and you don't have a chart with these notes in your clinical notes, it's rapport. I teach our assistants, we work with the hygiene department, but everybody on the team works together in harmony. So I teach them all to be asking certain questions, like the assistants, when they're seeing the patient, they can say, what is one thing that we can do today to make your appointment the best ever. What are your smile goals? There's different questions that we create and ask the patients, kind of creates rapport with them, update, just getting updates from the patient that's been seeing us for the last 10 years, but kind of reconnecting with them and making sure they feel like it's all about them. It's patient-centered care. And listen to their words. Listen to what they're saying and feel it. I don't shake people. I don't like to shake people's hands anymore. I've become more germophobic since the pandemic than ever. But I can feel it, just kind of feel what is the vibe and respond to that. If they're slow talking, if they're soft, you want to match that, mirror their tone. If they're talking about how they felt stressed because of traffic, understand that they're stressed today and say and do things to help them remain calm. Say and do things if time is a challenge or a pain point for them. Help them understand that you want to save them time, that you're aware that they don't like to take off from work. So you're going to accommodate them as best as possible, that you're going to make sure that you don't have to spend so much time treating their gums or treating that hole in their tooth. So understand your value. I've given you just a little snippet here of how to understand what they value. Always know, what are your patients' smile goals? Some patients will tell you, I just want a healthy mouth. And I love those patients, because now I'm talking about, there's some inflammation here. I see just a little bit of bleeding. I know health is important to you. I want to show you this one area so we can halt any disease potential in the future. Or I know you're concerned about your health, or I know health is important to you. We haven't seen you for the last 18 months. Let me show you. Let's look together what's going on. And then we're going to look at the infection. We're going to look at the inflammation. We're going to look at the bleeding. And I'm going to delicately explain to them in their terms exactly what's happening and the risks of not putting a halt to this disease. Attach a benefit after you know what the patient values. Use the benefit attached to their value. Okay, I hope that makes sense. Now the R2R, I shorten is reason to return is R2R, and it does become part of your clinical record. Yes, you have templates, right, in your electronic charts. So in your electronic charts, hopefully you have the template. The last line is the R2R. So if I'm the hygienist, I'm going to share with you an example, and I want you guys to start thinking about, when we do a case study here, what are the patient's values in this case study? Imagine you're Gandhi. Your patient is number one. Make it patient-centered care. Be a Gandhi. Be a Gandhi. Care. Show that you care. Too many times in today's world, I actually read reviews, and if somebody wants to work with me, I'm reading your reviews before we work together, because I want to make sure that I'm working with somebody who can grow, who can have patients flocking to them. And I have to be, I'm going to be straight with you. I'm seeing a lot of patient reviews, and they're not just mean people, but they're saying things like, the doctor didn't listen. They're saying the doctor didn't listen. They're saying the doctor is doing things that made them angry. And one of the things talking about reviews, I'm not here to talk about reviews, but nobody's responded to those reviews. And I can only help people who really are transparent and really care about their patients. Those are the people that I want to help grow. Those are the people I want to partner with. And that's why I teach what I teach, so that everything you do can be about the patient. So I hope that you'll take this back, and everybody in your team understands the value in this information. Why is this important? Well, the hygienist, as your hygienist, I told you, as your hygienist, I'm listening and I'm caring about what that patient's saying. And then when doctor comes in, I find a way to translate that over to doctor. So doctor knows we've been talking about a hole in the tooth. We've been talking about inflammation, bleeding gums, that Mrs. Jones is very concerned about being healthy the rest of her life, that she just lost her job, or money is a challenge right now, or her daughter is going off to college, and then her son, he's been in college for the last year. Now they've got 2 kids in college. Like, okay, doctor, hello. This patient's got a lot of money going out the door. So we're going to talk about saving that lady money if she has any treatment needs. During the patient power play pass, that's that handoff from the back office to the front office. So I'm going to say, today we did treatment for gingivitis. I took some x-rays to check any cavities, no cavities, healthy mouth, but we did see that there's moderate to severe inflammation, and I need to see Mary back in 2 to 4 weeks, and I'm going to reevaluate, and hopefully the inflammation is no longer there, and we'll treat her for preventive care. But I want to make sure that we put a halt to the disease. So I've scheduled her in 2 weeks for Tuesday at 4 p.m. And then, oh, that's, I'm sorry to hear about that, but gosh, I'm glad we can get that under control. It looks like your insurance covers 2 of these appointments. This is the second one this year. When you come back, everything's covered, blah, blah, blah. Good news for that patient. It also improves case acceptance when everybody knows that this patient's they value their health, that money or time is a challenge for them. It's going to be part of the clinical record, and you are all looking at that last line that says R2R in the clinical record, and you see what is that patient's pain point, their value, and then what is their condition and what is the benefit. We're using these words, the same words in the back office we're using for financial arrangements. And here's the thing, why we're talking about this today is because you should easily be able to click on that electronic chart when their name pops up on your desktop computer and look at their R2R. It's used when scheduling the appointments. I'm your hygienist. I'm scheduling your next preventive care. My hygienist is saying, Debbie, the reason why your gums and your teeth are so healthy is because you come in every 6 months. Let's keep up the preventive care. I'm going to schedule you for X amount of time. True story. My husband went to our hygienist and she said, when would you like to come back? And he said, what do you think he said? He said, I can't believe you just asked me that question. I never really want to come back. Don't you know you're not supposed to ask me when I want to come back? This is part of the R2R. It's used to when scheduling that appointment. And Greg, your gums and teeth are always so healthy. I'm so happy that you started coming in every 6 months. Let's get you back. And I'll see you in January 26th, 2 p.m. I know you like the afternoons. How does that sound? Like that's how you present that. And Greg knows that he's going to show up, and he writes it in his phone. He puts it in his phone here, and then he gets reminders. So your value, understanding the value before there's even an objection, you're able to attach a benefit. Who should use this R2R? Everyone, the doctor, the hygienist, front office, scheduling coordinator, financial coordinator, the assistants, everyone should know the R2R. And especially when patients call to cancel. I hope that you have a patient engagement software. We have access to great patient engagement software where you're getting the text messages and the emails are going out. And so I want you to reach out to me if you are not happy with what you have, because I get discounts on all these things. So I'm happy to share that discount with you, and I'm happy to help you set up your text messages. And your text, your engagement software should be one where when a patient calls, their name shows up and you can click on their name and your practice management software opens up to their clinical record. Now you can look at their R2R and you can see, looks like she's got gingivitis in 2 weeks. Those gingivitis patients, when they come back for the reval, they're like, hey, I just had my teeth cleaned. I don't need to come back. And then oh, it looks like Debbie saw you for gingivitis. She wants to make sure we put a halt to it. I know you have high blood pressure, you're taking the medication, and these things all correlate to systemic diseases, you know, heart attack, stroke, even Alzheimer's. So we want to make sure that we put a halt to the disease process. And that's why she's got you scheduled. If we see you every 6 months, like we have been, we'll never know if the disease is now, if there's a halt to the disease, we will never know. And it could still be there causing, it's like, I call it burning embers. The fire's still burning, and maybe it doesn't seem as bad, but we want to make sure that we put a halt to disease. That's our overarching message, is putting a halt to disease. Prevention is key. Like I said, if you didn't write that down, prevention costs a little bit of money, a little bit of time in the dental office. But treating disease, oh my gosh, it costs so much more money, and it costs time in the dental office. So let's talk about writing your R2R. Abbreviations work well. You're going to use their value, their condition, and the benefit. So you're going to write like gingy. I just put ginge or ginge, inflammation. You can maybe you have like, everybody's templates are different. Sometimes you have a box that you can check off, or in the R2R, you can have a box that you check off with different options. Some have where you can just back out. So this patient, I know, if I'm your temp hygienist today and you tell me we have an R2R that tells you what happened, you know, last appointment, why are they coming back? Gingivitis because of inflammation. I know this patient also has high blood pressure, and their thing is that they want health, and we want to improve their health. So that's why they're coming back 2 to 6 weeks later. So if they were calling, you know, I just told you what you're going to say to that patient when they call to cancel. Let's work on this patient together. So before we go on, I want to tell you, when a patient calls to change their appointment, the first thing you do is their name should be seen on your desktop, and you're going to be able to click on their chart. And I want you to look for their R2R. And now you're going to talk to them regarding the R2R, and you're going to tell them, Debbie's concerned about the gingivitis. She's concerned because you have high blood pressure, and with high blood pressure, this can get out of control and cause other challenging situations to your health. I know your health is important. So what can you do today to keep this appointment? Because here's another thing. I want, you know, it's a little white lie, but you can tell them we don't have anything available for. This works well. 6 weeks, we don't have anything else for 6 weeks. And there's a chance that this could get worse in the next 6 weeks. What can you do to keep your appointment? Unless it's a dire emergency, or maybe, I mean, I definitely think you should tell them, do not put them in the next open hole that you have in your schedule, okay? Unless it's an emergency, unless, you know, like I make mistakes. There have been times where I have forgotten an appointment. True story. I forgot an appointment for my haircut. Oh my gosh. You know how much, you know what happened? She charged me $60. When I went to my appointment the next time, she said, oh, you didn't show up for your last one. And I had a valid excuse. And she goes, but it's $60. My hair. And doctor, many of you watching this are afraid to charge the patient, but I don't want to go to another hairstylist. So I paid her the $60. And I'm like, she's running a small business. Okay. I screwed up. I told her I screwed up. I told her, I'm so sorry. I did have an emergency situation. So make sure that your R2R, you know, I've written it out for you in your handout, how to use it. So let's now go to this. So Anna's 28 years old, and she's a graphic artist. She likes to do yoga 3 to 5 times a week. And what do you think she values? Probably her health, right? She has beautiful teeth. So the first word you're going to write down in the R2R is what she values, her health. Well, so I would write down, you know, what she values, and then what is her condition. Maybe it's aesthetics. She has 20 4-millimeter pocket depths on probing, and all the other areas are 1 to 3 millimeters. She has 15 bleeding points. She has generalized severe moderate to severe gingivitis. She was treated for gingivitis. So add words that the patient values. Gingy, inflammation. I could put aesthetics, I could put health. And then we know that she needs to come back in 2 to 6 weeks for hopefully a prophy. But we know that health, that's what she's concerned about. She told us. And she told us that she loves to do yoga because she knows that it participates in making her feel healthy and that she is a lot healthier. So here's your R2R. I put gingivitis. She does have gingivitis, aesthetics, or health. Both of them can be what she values. Improved health, beautiful smile. And then we have the next visit. We know the next visit is we're hoping it's a prophylaxis, but we're going to tell her we want to have you back. We hope it's preventive care. Most patients, when they come back after gingivitis treatment, 2 to 6 weeks later, they come back and most people are healthy. But if they're not healthy, there's another step that we take. And by the way, email me if you want training on that, because a lot of people are confused about treating the gingivitis patient. That's another course. So I just want to recap with you because we're getting up to the hour and I don't want to take a lot of your time. I want to give you as much information as I can. And by the way, I've given this course for 3 hours at some of the dental conferences. So this is kind of a brief overview of how you can do some things to reduce cancellations. So the best system here is cancellation procedure, your powerful words, and a reason to return. Put that as part of your chart notes. Step 3. Now I'm just going to talk about this a little bit. I created this back in the early pandemic of 2008 when those doctors were calling me saying, look at the hemorrhage in my schedule. How can I get these patients back? And what we used was a teeth whitening system. And the doctors had to make trays. And then in 2020, with the next pandemic, I revamped this and I call it the Smile Club. And we use it because when they do come in when they show up and they don't change their appointment last minute, they get a free whitening pen. The whitening pens I've always offered, this is what we were selling to dental offices wholesale, very inexpensive. They had to make the trays, but there's no longer a tray to be made. We actually have this light with a comfort mouthpiece, and it actually has a red LED light. I don't want to talk to you a lot about it. If you're wanting to learn more, just click in your handout to schedule a quick call. Let me know you want to know more about it. But we show you how to use it. It's white glove onboarding. So we give you all the forms to get your patients enrolled, kind of like joining Netflix or Amazon, Costco, Sam's Club. But it does. The number one thing I hear is it reduces the cancellations because patients are like, what's in it for me? So they get a free whitening pen when they're enrolled in the program. They get one of these and then they buy more of them. And you guys are making like at least a net of $70,000 to $100,000 more annually if you're using the program. And a lot of your peri patients, kind of funny, but they all want whiter teeth. So I actually have the red LED light, which heals, soothes, and comforts. Also, implant doctors like this mouthpiece. Patients buy it. Patients who get canker sores, aphthous ulcers, they want this light as well because it does heal, soothe, and comfort mouth sores. It also is a great way to boost cosmetic cases because we're showing you how to implement a smile evaluation very easily, annually, and on all new patients. I want to tell you guys something. Since 2020, teeth whitening, and you can go to Google and search this, teeth whitening, the market value it's on tap probably by 2030 to be $11 billion. But right now, by next year, it should be a $6.4 billion business since 2020, because so many people are doing Zoom meetings. They're seeing themselves at home in all these meetings. They're at home looking at themselves and they want to look better. So this has really exploded, but it's not because of dental offices selling teeth whitening. You know, if you're still doing the Zoom whitening, imagine I told you that chair should be bringing in $800. So this the Smile Club is going to bring your hygiene department $100 net each time a patient enrolls. So this is the Smile Club. This is what they leave with. You get a smile. I show you your hygienist how it's your hygienist that implements it. And I show your team how to do this. It's white glove. We hand it to you, and all you need to do is exactly what we teach you. We have all the promotional materials. So the patients are all getting a smile evaluation. It takes 60 seconds. And that's what drives cosmetic cases. We teach you what to put on your website so that you drive more new patients, because there are thousands of searches for whiter teeth going on in your neighborhood right now, but they're not finding your website. So we show you how to tap into that. And so it's a new patient special that you can put on your website. You can put it on your social media posts. We have the promo materials to put around your office. So patients are like, what is this? Oh, great, I want this. And, knowing that keeping their appointments, following your change of appointment procedure, they get a free whitening pen. Like, how many patients are going to be counted in? Yeah, they get a free toothbrush, but this probably costs less than that toothbrush, floss, and a little tube of toothpaste to give your patients this. So think about it. This is the smile evaluation that we share, and we explain to you how to simply do this very easily. Here's the whitening kit. I'm showing you the red LED light. Always, I just want to give you some helpful tips before we end. Always be an advocate for your patient. Change selling to serving. Imagine you're serving your patients, and always embrace change in dentistry. The best people that we love working with when we're coaching your office is people who have a can-do attitude. I'm so excited about my team because they have a can-do attitude. It's been a while since I've been able to find some great people to help me in the background of my business who have that attitude. Also, we do not treat a tooth, guys, and hygienists do not clean teeth. It's all about treating the whole patient. We're helping our patients live a longer and healthier life. That should be our mission. It's why we do what we do. We're treating the whole body. Just one more tip is, if you're getting a lot of cancellations for big cases, what we teach when we're working with our clients is how to accept a reservation fee. It becomes like a deposit. It's a reservation fee. Patients pay a certain amount of the restorative, and there's actually a fee associated, and they know on their treatment plan. Remember, they've got to see it on their treatment plan. They're signing their treatment plan that they have to give you a certain amount of hours notice. I recommend 72 hours notice if they need to change. If they've signed that and they don't have a legitimate excuse, that they just think they need to get their nails or hair done, which is a true story. I'm sure some of you experienced that. They lose $100 at least for the restorative. So handling chronic patients who constantly no-show, I think you guys need to be bold with them, change their appointments the last minute. It's like, Jane, this seems to be a problem. And what I'm going to do is I'm going to put you on the ASAP list. And when we have an opening, we'll call you and let you know. We'll send you a text message. I mean, you guys got to be bold with them. They cannot treat you. Teach people how to treat you. And you guys are running a business. And I'm telling you, like, people are not opening their wallet like they were a few months ago. People, when the economy does certain things that are happening right now, I'm not saying this to make you feel fear, but I'm just telling you what I know is happening. I know that at the corporate level, our dental companies are pulling back because they feel the patients are pulling back in a lot of these dental offices. So I'm delivering a message to you that this training today can keep you ahead of the curve. I want to ask you, what is one thing that you're committed to doing differently tomorrow? Do you want to go fast or do you want to go slow? Write your commit. This is what we do when we're coaching and consulting. This is one of our, everybody, we sometimes have large teams and multiple offices. So this is, this is a 2-office location, and everybody went around and said, what is one thing they're committed to? And this one assistant, she wrote it down. So I ask you, what is one thing you'll implement tomorrow when you go back to your office? And what is it that this one thing will change for you? And how can it make your life better in the office and personally? I wanted to read you this about status quo. Status quo, you know, is Latin for the mess we're in. Do you want to remain status quo? In dentistry, we always have to grow. If you stay status quo, doctor, when you go to sell your practice, it's not going to be worth $1 million like it could be if you keep growing. Small group, I'm putting a small group of dentists and hygienists together to boost hygiene department productivity. If you want to know more about this, it's not free, but like I said before, the ROI is way more than what you've got today by doing the same thing. The ROI is, when somebody works with us, the ROI is, it's higher than if they bought real estate, invested in real estate, or invested in the S&P 500. So if you don't ask, you will never know. I would love to have you be a part of our small group. This is by private invitation because you're here. All right, so we have some questions. Somebody's asking, what type of reminders work well to help reduce cancellations? This is a great question. What I think works well is 2 weeks before, 2 days, and even 2 hours. So you can send out emails and text messages, definitely 2 weeks before, an email and a text message. And then I even think two hours before works well, even if they have confirmed. It just helps me. So 2, 2, and 2, 2 weeks, 2 days, 2 hours. Somebody asked a question. How much do you charge for your reservation fee? I did mention that we do arbitrarily say $100 if it's restorative, but ideally it would be 10%. So, you know, their insurance is only going to pay maybe 80%. So have them pay a reservation fee of 10%. It works really well. In fact, what I found was working really well was if we had some doctors, a lot of our doctors do, the doctor alone does $10,000 days, and they are asking for patients if they can pay in full, and they give them 3 to 5% discount if they write a check or brings, they figured it out, but it worked really well. And by the way, the doctors that we work with did actually complete the care. The doctors that we work with, we've been very blessed. We have doctors, they've actually become friends now. And yeah, I fall in love with our clients, and they're wonderful people, but you know, we only work with people who are transparent and who really have that can-do attitude and who are coachable. And I hope that if that sounds like you, that you'll inquire about our small group. I love what I do. I've been doing this. I'm not even going to tell you, but okay, should I tell you how many years I've been in dentistry? I started when I was a teenager. Next year is going to be my golden anniversary of when I was a dental assistant. Yes, so I've worked in every position except for being a dentist drilling on a tooth or extracting a tooth. I've done everything else. And at 19 years of age was managing a dental practice while I went to school to become a dental hygienist. And I still love it. So, you know, I'd love for you to click the link in here, and I hope to see you on the other side. And be sure that you register for another one of our power hours. The month of September, we're going to talk about implants, and I'm going to share with you something new that a colleague of mine in Canada has created to make implants. It's taking implants to the next level. So hope to see you on that one as well. Thank you so much for joining me, and make it a great summer. Bye for now.